Good morning, everyone. My name is Ramsey Ataya. I'm one of the third years at Kendall Regional Medical Center. And today I'm going to be presenting to you about abnormal urinalyses in asymptomatic individuals. Of note, there are no conflicts of interest from myself, from Dr. Zidek, Mr. Shear, or Ms. Santos. Why did we decide to pursue this study? So the urinalysis is one of the most commonly utilized tests in the emergency department. It's routinely ordered by protocol on patients with abdominal pain or even elderly patients with altered mental status. Even if these patients do not specifically have these symptoms to suggest a urinary tract infection, sometimes urinalysis results demonstrate pyuria or bacteria to suggest an atypical presentation of one. While it is possible these patients may have an acute urinary tract infection, it could also be that these patients have a baseline pyuria or bacteriuria. And many studies reflect the high prevalence rates of these asymptomatic bacteria among volunteers of up to 50%, with higher numbers among the elderly. So our study was a prospective observational study that looked at asymptomatic volunteers older than 18 with no acute illness or symptoms such as dysuria, vaginal bleeding, fever, had no recent antibiotics within the past 72 hours, and no recent urologic procedures within the past month. We excluded pregnant patients, prisoners, and those with acute symptoms. This was IRB approved from our local IRB institution. For purposes of this study, we defined a positive urinalysis as one that shows at least 1+ leukocytes or positive nitrites, with the main intent of looking at primarily the frequency of positive urinalyses among asymptomatic volunteers. And secondly, to see if there were any predictive variables of these urinalyses when stratified across age, gender, other comorbidities, as well as living situation, whether they live in an ALF or whether they live at home or elsewhere. So we enrolled 200 subjects. Volunteers ranged from 19 to 97 years of age, with an average age of about 50 years. Of these 200 volunteers, 52% were female and 48 were male. In regards to our primary outcome, 23% of the 200 enrolled had asymptomatic and positive urinalysis. 5 of those subjects had nitrites detected in the urine, while the remaining 41 were positive urinalysis from the presence of leukocytes alone. If you take a look at Table 2, you'll see that the frequency of positive urinalyses are stratified by age and gender. If you look at the age as well as these rates, positive rates, you'll see two main trends. One trend is that with increasing age is an increasing composite positive rate of abnormal urinalyses. What you'll also see is that these same results are indicating that of the female volunteers, a high percentage of these compared to male volunteers tested positive for these urinalyses. You'll see these trends reflected in the univariate analysis that were performed as shown in Table 3. Most specifically in the multivariate analysis, female gender as well as those residing in an assisted living facility were significant positive predictors of having an abnormal urinalysis. The rate of positive urinalysis in women was 38.5% compared to men at 6.3%. For assisted living facilities, this was 53% compared to 12%. So what do these results mean when we're putting all of these things together? Well, it is important to realize that this is the first attempt at assessing urinalyses across multiple demographics. It's important to recognize that out of the sample size of 200, certain other trends may have shown had we had a greater sample size. I think it's also important to recognize that when comparing to the prior study that was done only assessing women as it relates to asymptomatic bacteriuria, we actually had a lower rate compared to the prior study. In conclusion, there is a high rate of abnormal urinalysis among asymptomatic individuals, particularly among women as well as assisted living facility patients. Given the potential harm of treating asymptomatic patients, I think that the ordering of urinalysis should be restricted to those with symptoms that are suggestive of a UTI.